Introduce myself. Well, I'm a GP, of course, and co-owner of a group of practices that are called M3 Health. And those clinics at the moment are located in Spotswood. We call that Hobsons Bay. There's one in Bayswater, and there was one in Ascot Vale until a few weeks ago, and I'll walk you through that in a moment. I'm based in Spotswood. Spotswood is 2 stories. We have a pharmacy and pathology co-located downstairs. There's a 5 consulting room, 1 treatment room after hours clinic that was closed when the government changed the rules around co-locating after hours and in-hours services. Upstairs, we've got 16 GP consulting rooms and 6 allied health rooms. The 6 allied health rooms were full up until recently, and again, I'll walk you through that in a moment. There are a couple of things that concerned me about COVID, and that will explain why we made the changes that we did. The first one was that it is not like anything we know. And one of my concerns was that a lot of high-profile people were calling it the flu or a cold. And the problem with that, of course, is it creates what I'm going to call an availability heuristic. So we think, oh, well, I know the cold, I know what a cold is, I know what the flu is, therefore I can manage this. It is nothing like any of those. The most common presenting symptoms are lethargy and myalgia, and the median temperature for patients presenting to hospital, according to the BMJ, was 37.3. So what that said to me is you do not know what this is. You have never seen anything like it. And the next bit that concerned me was the number of people that are asymptomatic or minimally so, and they can spread the virus fairly easily, I think. So that was a big concern for me. And the last bit was the variable incubation period, which again, much like the group above, meant that there's a fair chunk of people that can spread the virus relatively easily. And so what these things meant to me was that we needed to consider the clinic on the basis of how many different transitions we were going to make. So if this is the present state, and these are all the future states, and let's just call this last one the desirable state. So this might be considered the state where we would be when there was fairly large numbers of communities spread, and this is the current state. The question then is, how many different pivots do you want to go through to get to the future and desired state? And this is something you can relate to many things in life, but we know that the reality is that over time you're going to have to make some changes. And I'm lazy, so what I wanted to do was to delete as many of these steps as possible. So the transition state, I'm going to call it, for us was 4 days. So we went from 100% face-to-face to 100% tele within 4 days. So the transition state was only for a very short period of time, and this is where we were doing screening, you know, about if they were unwell, if they had any unwell contacts, if they'd travelled, etc. We created our own resources because they didn't exist. We wanted to move quickly, and what we decided was that there were really there was a couple of priorities for us. The first priority was we looked at everything like it was a pyramid, and what that meant was there were really 4 layers, and they looked like this. The base layer was safety. We needed to make sure our people were safe before we could concentrate on anything else. And then if we knew they were safe, we could focus on resource allocation. And once we were able to focus on resource allocation, we could then focus on innovation. And if we could get the innovation right, we could potentially thrive. Now, thrive is a relative thing in a pandemic, but it is still really important. And it looks like there are 4 layers here, but in fact, there are only 2, because this base state is a mandatory layer, and this is all about survival. Oops. All about survival. And this next layer is all about growth. And we know that we had to get to fixing the survival layer before we could get to anything else. And so we quickly got on to safety. That allowed us to then focus on resource allocation, and we've been innovating furiously so as that we can hopefully get to thrive. We only really had to focus on massive changes to the physical environment during the transition stage. And in the transition stage, we really had 2 things to focus on. The first one was to make sure that people undertook new behaviours. And the main new behaviour was distancing. So we incorporated non-touch payment methods in the practice. For example, activating services so that they could be phone payments, and any payments were contactless, so people weren't touching common touch points like PIN pads, etc. And we know that we had to redesign the physical environment to support the behaviours that we wanted. So non-touch, appropriate social distancing, and making sure that we had that happening within the team as well as between patients and the team. So the physical environment supports the behaviours we desire. And now that we are 100% tele, we have an environment whereby most people still choose to come into the workplace, but within the workplace, social distancing is in place, and we make sure that we reduce the risk of synchronous spread through our team. First thing I would say that you all need to be looking at doing is to connect. And you will have heard Brené Brown and Simon Sinek talk about this, but it needs to be a psychologically safe environment. Otherwise, you're going to see failures come thick and fast. The next thing is change behaviours. We need to change our behaviours. I think one of the reasons why we've seen so many famous people and political people infected with COVID-19 is because they are not willing to change behaviours, and generally they've had the world bend to their intent, and so you need to change the behaviours, and you need to change the environment to sort those behaviours, to encourage those behaviours. And that's at home as well as at work, of course. So you're going to need to invoke new rules in your household. And that is it from me. So I'd like to bring things to a close. Thank you for your attention, and I hope that's been useful for everybody.